The following segment is sponsored by Parker Cornea. Welcome back, friends. This morning we are talking about the importance of taking charge of your eye health, especially when it comes to diagnosing diseases of the cornea. We have an expert this morning, a corneal specialist, Dr. Jack Parker, joining us. Dr. Parker, thank you so much for coming in.
Of course, my pleasure.
This is your area of expertise, and you are well versed in this and highly qualified. But I wanna start from the beginning here. What is the cornea? Where is it on our eye?
The cornea is the clear front part of the eye. It's the part of the eye that the contact lens goes on. It's the window that lets light into the eye to begin the process of seeing.
Very important to make sure it's healthy. What are some common diseases of the cornea? What are some issues that people might have?
The cornea is where vision begins. And so any sort of vision problem basically can be triggered with a problem in the cornea. There are lots of things that are very, very common issues, especially among contact lens wearers or people as they get on in life. One of the things that is most common actually is this condition called Fuchs Dystrophy, which I was hoping to talk with you more about.
Certainly, yes. So you're saying this is a common issue that people
common.
experience and that you all treat these patients with this disorder.
Fuchs Dystrophy, it's a term that's a little unfamiliar to people, but it's a condition that's extremely common. There are definitely people listening right now who have it. It's a problem with the clarity of the cornea. So normally the cornea, of course, is clear, but in people with Fuchs dystrophy, the cornea becomes swollen and hazy and cloudy. Rather than letting light into the eye, instead the cornea starts to filter and block light from coming in. I had one patient describe it to me as like looking through the world through a dirty fishbowl with Vaseline smeared on the side. It's actually symptoms that are not too dissimilar from cataracts. And so there are lots of people who think they have cataracts, and maybe they've been told they have cataracts, but really this is the problem, the cornea.
Wow, interesting. So yeah, and I can imagine that was such a descriptive message that your patient was giving, and you can imagine too, yeah, if the clear part of your eye, you know, that's essential for vision is cloudy, you're not going to see very much.
Right.
Are there other symptoms associated with it that maybe can clue somebody in, hey, this isn't cataracts or this isn't a normal issue?
Usually, the most specific symptom of Fuchs dystrophy is morning blurriness. So you wake up in the morning and things are blurry and hazy for a few hours until things gradually start to clear up. And the reason for that symptom is the cornea is swollen. And over time, as the day goes on, it dries up a bit. There are some patients who have figured out they can accelerate that process by every morning, they wake up, go into the bathroom, turn the hair dryer on their eyes and dry the eyeball out because the eye is soggy, wet, swollen.
That sounds very unpleasant.
Beyond that unusual, weird, specific symptom, the symptoms of Fuchs dystrophy are actually fairly generic. The vision is blurry, you have starbursts at night, things are just not as crisp or clear. In other words, it can mimic the symptoms of many other eye problems. So there probably isn't a great way to know definitively that you have it without an eye exam.
Now, when somebody comes in and you find that they have this, where do you go from there? And this is curable.
Fuchs dystrophy is completely curable. So the most important part of the process actually is just to remain calm because it's a curable disease with an excellent prognosis. Now, we used to treat Fuchs dystrophy by replacing the whole cornea, okay? But there's a much better way now. Rather than replacing the cornea, it's possible to fix the patient's cornea. And the way that we do that is we can take a collection of healthy cells from a normal eye and just put them inside the eye with Fuchs dystrophy. And those healthy cells will clear up the patient's cornea again. It will restore the clarity of the cornea to how it used to be. And this cell transfer therapy is called DMEK, D-M-E-K. And the process is painless. It takes 10 minutes. And usually, it's done in the office. So patients don't even have to go to the operating room in order to have this corneal dystrophy cured.
Wow. That's incredible too. And so when a lot of people think of, diseases of the eye or having to go to an eye doctor, an eye surgeon, they think eye surgery. A lot of people are very nervous about that. But this sounds very quick, and that there doesn't really need to be a reason to be nervous about it.
It's one of the greatest advancements in all of ophthalmic medicine.
And this is something that is available at Parker Cornea. You all specialize in this, and those techniques and diseases of the eye that a lot of other people can't treat.
Well, there are many wonderful doctors, eye doctors here in Birmingham and in Alabama at large who do a fantastic job. But really, what we consider to be our missional work, the idea behind Parker Cornea, is to treat the most difficult, complicated, demanding cases that other doctors can't or don't want to treat. And so that's what we think our little niche is, and that's what we hope to be able to provide for people.
Wonderful. And that information is on your screen right now, parkercornea.com, and also the number on your screen. Dr. Parker, thank you so much for your time this morning.
Thank you so much for having me.
Of course.